picture. I hit the function, hit the rose till I hiccup. I hit the stage and leave with money that's a sticker. She picture perfect, so I told him I'm a flicker. Feel I'm in the mood for a change up. I leave the city and return with my change up. They got amnesia, don't remember how they played us. They wanna knock me down, but somehow I just stay up. Look, straight from the mud like Ruby. Straight to the stage, they love me. I understand they hungry, but please don't hate, that's ugly. I've been sliding, shaking, moving. I've been popping in my city. Shawty say she love the way we do it with me. I be too turned up to ever give a fuck. I ain't come to argue, let a nigga fuck. They been talking pennies, I need bigger bucks. About to catch a flight, I need to switch it up.
Welcome to Better Than Ever Live, wherever you're watching, wherever you're listening. I hope you're making today your masterpiece. On today's show, we're going to talk about a relatively new advance in the treatment of osteoarthritis called α2-macroglobulin. We're going to talk about what it is, how it appears to work, and what its potential role could be in the treatment of arthritis. I'm Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert, and media medical expert. I help you feel and perform your best regardless of age, injury, or medical history. Please understand, as in every live stream I do, every video I do, I am not giving you medical advice. This is meant for general information and educational purposes only. If you have comments or questions about either osteoarthritis or α2-macroglobulin, feel free to leave those in the chat. If you're on YouTube, use the chat, not the comments. I can only see the chat. That's what comes through to me. If you're watching this on Twitter, welcome. This hopefully is the first time I've been able to send live streams out to Twitter in addition to YouTube, Facebook, LinkedIn. So that's pretty exciting. I would love to know your first name and where you're located, along with your comment and question. That makes it a lot of fun. All right, I want to get into this. I literally just talked about this in my practice today. We were talking about arthritis and what was out there, potential new treatments, things like this. I'm really excited about this, and that's called α2-macroglobulin. What we know about it, and we're going to talk about this more and more, is that it seems to inhibit the inflammatory factors that break down the cartilage in osteoarthritis. And so we're going to talk about this study that came out just recently, just in September of this year in Frontiers in Pharmacology. Let me set it up real quick, because what they look at is arthritis that develops after ACL injury and ACL reconstruction. That is one of the most common injuries that young people suffer. Now, I get annoyed when people tell me, oh, he told me I needed surgery for my ACL because it will prevent arthritis. There is no evidence that it does that. That's not even the point of the surgery. The point of the surgery is to restore stability to the knee to allow you to land on it in sports and change directions with sports and exercise and all your daily activities. Now, if you don't have ACL reconstruction, we know that the rates of knee arthritis down the road are much higher. I've seen numbers as high as 9 times higher than the opposite knee that didn't have the ACL injury. If you have ACL reconstruction surgery, you still are likely to get arthritis, just not as likely as you would be if you left it alone. Even no matter how good the technique is, you're still at a high risk for post-traumatic arthritis. Now, again, that's been shown multiple times. Cartilage degeneration still occurs despite the reconstruction. And what it appears is that at the time of injury, there's this huge expression of inflammatory factors that cause cartilage injury. We've talked about some of these in a variety of different Better Than Ever Live shows. Those are things like interleukin-1 beta, interleukin-6, tumor necrosis factor alpha, that initially, a week or two after an injury, they can have some positive inflammatory roles, but then you want them to go away. If they don't go away, like in an ACL injury, those interleukin-1 betas, interleukin-6, tumor necrosis factor alpha do damage to cartilage and bone, and they bring other factors, other proteins, other enzymes like MMPs, matrix metalloproteases, that further damage cartilage and bone. After an ACL injury, those inflammatory enzymes, cytokines, they're really high 48 hours after you injure your joint, starting to cause cartilage cell death, and it eventually breaks down the cartilage matrix. Now, back to α2-macroglobulin, why this is potentially so exciting. This is something that's normally in our blood. It's made by the liver. It's found in our blood cells. And it has a number of different benefits: getting rid of pain for subacromial bursitis, lateral epicondylitis, tennis elbow, Achilles tendonitis, even spine disc type pain. But giving somebody synthetic α2-macroglobulin has a number of issues, cross reactions and things like that. So what people have looked at is, and a company in particular, Cytonics, has looked at a system to basically take your blood and amplify the amount of α2-macroglobulin in it, and then potentially inject it into joints. Yes, we have α2-macroglobulin in our blood. We don't have much in our joints because it's a very large molecule, and then that makes it hard to get into joint fluid. Now, the study I was talking about from Frontiers in Pharmacology, September 2022, was a study done in mini pigs. Basically, they took 13 milliliters of whole blood in basically a coagulation tube, put it through a centrifuge, much like PRP, to get 6 milliliters of serum. That was added, and I don't know exactly how the system works. I want to find out more about it, but there's an upper filter, some sort of ultrafiltration tube, and then it's basically spun at different, 3,000, 4,000, 5,000 grams, anywhere from 20, 30, 40 minutes, because they wanted to figure out the best concentration conditions for making α2-macroglobulin. Then they also isolated chondrocytes from humans, basically cartilage cells. They were conditioned overnight, and then they were treated with interleukin-1 beta for 2 hours before treatment with α2-macroglobulin. The interleukin-1 beta, as I talked about, a very pro-inflammatory cytokine, can lead to degeneration of those cartilage cells, basically what turns into osteoarthritis. Now, 18 female mini pigs were put into 3 different groups in this study. One underwent a surgery that was basically nothing, a sham surgery. Open it up, close it. Next was an ACL reconstruction surgery, and then the next was an ACL reconstruction surgery that then they got α2-macroglobulin. They had already caused ACL injury in all these, or no, I guess they didn't cause ACL injury. They just did the surgeries. And then they collected joint fluid at a certain period of days after the study. And then at days 2, day 6, day 14, and 29 after surgery, in the group that was going to get the α2-macroglobulin serum, that was injected into the hind limbs of the pigs that had the ACL reconstruction, and they were in the A2M group. The sham group, just the ACL group without A2M, they were just injected with saline. Now, I told you they measured the joint fluid of those pigs at various points after the surgery, looking for interleukin-1 alpha, interleukin-1 beta, interleukin-2, interleukin-6, interleukin-8, 18, tumor necrosis factor alpha, TNF-alpha, and granulocyte macrophage colony stimulating factor. They also looked at biomechanics and gait before surgery and then after surgery, 7, 15, 30, 45, 60, 75, 90 days after surgery. 3 months after the surgery, they sacrificed the pigs, looked at their joints, looking for evidence of osteoarthritis by X-ray, CT scan, and actually looking at the cartilage of bone. Now, what they found for the α2-macroglobulin, the concentration of it was almost 5 times higher after doing this process than what's normally in our serum. So that centrifugation process, the filtration process, appeared to make 5 times as much α2-macroglobulin. In the pigs, it made almost 7 times more A2M through that process. So that was really helpful. What they found out by looking at the group that had the ACL reconstruction and then the periodic α2-macroglobulin serum injected into their limbs, it significantly reduced MMP13, tumor necrosis factor alpha, interleukin-6, and interleukin-1 beta in those the synovial fluid and in the chondrocytes, the human chondrocytes, when they gave the A2M serum to the chondrocytes that had been pre-treated with the interleukin-1 beta. It also promoted proliferation of the chondrocytes, meaning growth, making more of them, and it reduced the apoptosis, or the death of the chondrocytes. Very, very exciting there. Also, the viability of those chondrocytes after being treated with interleukin-1 beta, the ones that were given α2-macroglobulin, the viability was much greater, and it got better and better over time than the chondrocytes that were treated with interleukin-1 beta but didn't have the α2-macroglobulin. Again, the concentrations of those pro-inflammatory factors, interleukin-1 beta, interleukin-6, IL-18, tumor necrosis factor alpha, were higher after surgery, after ACL surgery, and after ACL surgery with α2-macroglobulin. That gets to our concerns about why you're so likely to develop post-traumatic arthritis after ACL surgery. Those pro-inflammatory cytokines are still swirling around, and that surgery doesn't do anything to stop that. But in the group that had the α2-macroglobulin on top of their surgery, those pro-inflammatory cytokines were significantly lower than in the group that just had the surgery without the A2M. Then they looked at x-rays of the joints of the pigs once they were sacrificed. The arthritis changes in the ACL reconstruction group were very noticeable. This is the group that didn't have the α2-macroglobulin. They had osteophytes, or bone spurs, on both sides of the patella, the kneecap, and what's called the trochlear groove, the patellofemoral joint. They had cartilage changes in the medial femoral condyle and medial tibial plateau seen on CT scan. That was seen in basically the group that had the sham surgery and the ACL reconstruction surgery without the α2-macroglobulin. But compared to the group that didn't get A2M, the ACL group that got α2-macroglobulin basically had low or no obvious cartilage degeneration, no big large erosions of cartilage. Even though they went through an ACL surgery, the α2-macroglobulin appeared to protect them from that. Also, they had a lot of positive findings as far as matrix metalloproteases. The ACL reconstruction group really high in MMP3, 9, 13, things that break down cartilage, much higher than the α2-macroglobulin. So this is what the researchers sort of concluded, and then I'm going to give you my thoughts on all of this. A2M seems to do a number of different things that affect cytokines and hormones within our body. And not things I talked about, but it seems to have effects on fibroblast growth factor, platelet-derived growth factor, nerve growth factor, but also what we did talk about, interleukin-1 beta, interleukin-6. But it's just not in synovial fluid, again, like I talked about, because of its large molecular weight. If it was, potentially we could mitigate cartilage damage with age, or at least post-traumatic arthritis. So what they have shown is by introducing α2-macroglobulin through α2-macroglobulin rich serum into the knee, that might be a really good strategy to prevent and stop cartilage degeneration after a traumatic injury like an ACL. Now, again, the advantage of a system like this, theoretically, is it's your own blood. You're much less likely to react to it, which is really exciting. But having said that, there's still a lot to go on. And I want to say, as I say anytime I talk about biologics, regenerative medicine, peptides, this is not FDA approved. It may be a long time before it's FDA approved. It needs a lot of research. There are places out there doing it. If you go to the company, you'll see some names of people, and they talk about good results. The data for this, I'm giving a talk in Napa next May, and one of my talks is on arthritis and sort of the newer treatments that are better than cortisone, better than arthroscopic debridement, and hopefully better than knee replacement, or hopefully to prevent knee replacement. But there's a lot of good data as I research the α2-macroglobulin. This is really exciting because, again, it stops those protein cytokines that are breaking down the cartilage. It seems to do that very well. Also, in this study, it showed that A2M helped with the proliferation of the cartilage cells, the chondrocytes. It decreased the catabolic cytokines that are breaking down cartilage. This is very, very exciting. Now we need human studies. At the end of the day, that's what it's going to take, and ideally human studies against a control group, placebo group. But this to me is very exciting. It also reminds me a little bit of penisin polysulfate, the medication that we've talked about. It's in phase 3 trials, being fast-tracked by the FDA, but there are places you can get it now. It's an injection you give yourself twice a week, just under the skin, subcutaneous injection, to stop those same inflammatory cytokines and matrix metalloproteases, the degradative enzymes. And there's been thought, hey, one of the great uses of penisin would be right after an injury like an ACL injury. In this case, though, what you would be talking about potentially is a procedure that you would inject something into the knee itself after an injury, A2M rich serum. Now, you could extract or sort of extrapolate from this. This is purely a discussion of post-traumatic arthritis. You suffer an ACL, you're trying to prevent the development of arthritis down the road. And again, we talked about how arthritis is not generally a wear and tear problem, tire on a tread wearing out that so many orthopedic surgeons talk about. It is much more an inflammatory issue. All those proteins and cytokines and enzymes breaking down cartilage and breaking down the bone under it. So this appears to be something that would in theory work on people with osteoarthritis even years later. Now, we don't know, it needs to be tested for that, but you're still working to stop that problem. This study is talking about it in a protective sense. We're going to try to stop the issue before those inflammatory cytokines cause their issues. But if you're a 50 or 55 or 60-year-old person, maybe you didn't even have an ACL injury, but you've developed osteoarthritis now, in my mind, this does appear that it would be a valid option. Now, we don't know, does it have any cartilage regenerating abilities? We talked about the chondrocyte proliferation, but we need human studies. But that's where also maybe this is something you do in addition to something like exosomes or stem cells or PRP, AOD 9604 with hyaluronic acid. Treatments that people have looked at and try to use to rebuild cartilage to basically cover that subchondral bone. So there's the stopping damage on one side, and then there's the rebuilding on the other side. To me, this is still early, but could be very, very exciting. I said this last week, I've said this a lot lately. I really believe that within 15 to 25 years, hopefully sooner, we can prevent or eliminate hip and knee replacements. I expect it'll be quite a challenge, and we won't be able to do it for people that are badly overweight and eat junk food all the time and have just rampant systemic inflammation throughout the body. But for people that are willing to lead a clean, healthy lifestyle and try some of the regenerative biologic treatments that are already out there or that we continue to develop, I really believe if you're 30 years old now, there is a good chance you're never going to need a hip or knee replacement. I truly believe that the regenerative medicine world, at least as it pertains to orthopedics, is going to figure all this out about how to rebuild cartilage, rebuild bones, stop the damage, and get the joint back to the way it was when we were younger, quite honestly. All right, if you have any thoughts on that, certainly leave those for me. If you watch this later, you can leave your comments to that as well. Otherwise, I'll leave the comment thing up for a minute or two. I'll close with this. If you do like videos like this, optimal health and wellness, what I call anti-aging orthopedics, anti-aging and regenerative medicine, trying to help you heal and recover from orthopedic injuries so you feel and perform your best regardless of age, injury, or medical history. Subscribe to this channel. Click the bell to be notified when I release a new video or when I start a live stream. And if you would like to see me as a patient, and about 2 or 3 people from across the country or world reach out to me every day, I'd love to see you. I'm a triple board certified orthopedic surgeon, sports medicine specialist in anti-aging and regenerative medicine. I truly believe that the best way to get back to peak performance after a bone or joint injury, ACL, arthritis, whatever, is to get the injury to heal without surgery. Instead of invasive surgeries with long recoveries, unpredictable results, it's worthwhile to at least explore innovative treatments, injections, medications. And the goal isn't just to decrease your pain, it's to heal your injury and prevent it from coming back. But even that, it's not just about your injury and recovery. It's about getting you back to what you love to do. Whatever your favorite sport is, or just exercising every day, or playing with your kids, getting through your work day without pain. I try to help you optimize your performance through improved strength, energy, speed, endurance, muscle, and much more. I want to help you overcome your injury, but also recharge your body so that you feel like you did when you were in your 20s. All right, that is all I've got, Susie. Well, if I can get you on the screen, interesting stuff. Thank you so much. I really appreciate that. Thank you so much for watching. Remember, if you can't be here live, make sure to subscribe to the Better Than Ever Live podcast, wherever you get your podcasts. And again, here just about every Thursday, 5 p.m. Eastern Time. I hope the Twitter feed worked. I'm going to have to go and check that here in a little bit. But very excited. If you have other orthopedic questions unrelated to arthritis and ACL reconstruction, join me tomorrow, 12 p.m. Eastern Time for Ask Dr. Geier Live. That's the one time, the one place every week where I answer your questions. Not giving you medical advice, but I explain the injury that you've had, explain the surgery if it's a surgical thing, explain the recovery, rehab, all of that so that you can take that information to your doctor. You're more informed, you can make better decisions, whatever's better for you. So join us pretty much every Friday, 12 p.m. Eastern Time. Join us tomorrow. I will be here for Ask Dr. Geier Live. Thank you so much. I hope you have an absolutely wonderful rest of your night.